All right, so this video is about what to do if you sprain your knee, right? So you can sprain your knee just like you sprain your ankle or any other joint in your body. And so a lot of times people will come in to see us with a lot of swelling on their knee, a painful knee, they're kind of limping a little bit, and they want to know what are some of the first things that I can do when I've sprained or hurt my knee. So the first question we usually get asked by people is, should I do ice and should I take an anti-inflammatory like Advil? And there's a little bit of debate on this because on some level, inflammation is your body trying to heal. And that's a good thing. We want your body to heal, right? But ice and anti-inflammatories help with pain. So a lot of times what we'll tell people is, you know, if this happens to you where you sprain your knee and later that day you had to go do something where you needed to walk a while or you had an important meeting at work and you thought your knee pain would be bothering you, something like that, then it's okay to ice and do Advil or things to decrease the pain because you still need to live, right? But if for some reason you don't need that and you're saying like the pain's really not that bad and I'm having a little bit of swelling but it's not too bad, then it's okay to let the inflammation do its job at least for a couple days, okay? So the first thing that we want to address when someone comes in with knee pain is there's usually swelling, and that swelling is usually around the joint, sometimes above the joint. And the reason that we want to address the swelling is because when there's swelling in the joint, your quad automatically, the muscle here that helps to support the leg, starts to get weak. There was a study that came out where they took a healthy knees, they inserted a teaspoon of saline into the knee to replicate swelling, and just by doing that, even though there was no injury, the quad decreased in strength by 20%. So there was a decrease in quad strength from fake swelling, right? Not even real swelling. So you can imagine an injured knee, the quad starts to get weak right away. So a lot of times elevating the knee, doing a little bit of that ice and ibuprofen will help to get that swelling down. And so once the swelling goes down, then we can start working on some range of motion. You can even do a little bit of range of motion earlier than that. But often what happens when there's swelling in the knee, the person goes to bend their knee especially or try to straighten it out. And when they go to bend, it's like it hurts. And the pain is actually a lot of times coming from the swelling. It's like their knee is inside a tight water balloon and they try to bend it and it just feels all tight in there is usually what people will feel. So once it's important to get the swelling down because then we can start getting that range of motion back and getting that movement back because you need that range of motion to be able to walk effectively and just do things like getting in and out of a chair. So once we start getting the pain down, start getting the swelling down, we're starting to increase range of motion. The next thing that we really focus on is getting the quad contracting again. So if you think about it like this, your quad is what takes up the pressure in the knee. And so when you're walking, doing things, and if the quad's not strong, that means the force goes to the knee, which will cause it to be painful and swelling. It's a little bit of like a chicken or the egg kind of cycle. So the first thing we have people do is do something called a quad set, right? Which is you take your quad muscle and you want to just squeeze that muscle only. And you can kind of know that it's working. One, you can see the muscle contracting, and then two, you'll see the kneecap slide up the groove a little bit. You also feel like you're pushing the back of the knee down while it gets lighter in your heel. So just like this, you can often do it just lying down. Sometimes it helps to have both legs, especially your other legs not affected, right? You can do them both together and watch the good leg do it so the bad leg knows kind of what to do. For whatever reason, that helps. So then once you get the quad going, and it can be hard to get going with the swelling, right? Remember, the muscle's inhibited because of the swelling. That's why we try to get the swelling down first. Once you get the quad going, then you're starting on your way to recovery. That's then how we would guide patients through a lot of other different strengthening exercises. But these are the steps that you need to take first. So ice, an ibuprofen if you need to decrease the pain. Then try to get the swelling down as much as possible. Then make sure you have range of motion by just bending and flexing the knee. Sometimes people use a strap to help bend it. And then as soon as you can, get the quad going by doing quad sets. And then beyond that, we'll enter into other strengthening. So that's what you need to do if you sprained your knee or hurt your knee in any way, is do those steps first. If you're having any issue with knee pain and you feel that we could help you with it, we can definitely help you with it, then please give us a call. We'd love to help you out with it.